Buenos dias, Zamboanga Peninsula, Basilan, Sulu at Tawi-Tawi. Ako po si Myra Espinosa. Samahan niyo po kaming muli ngayong araw para sa ating Bantay COVID-19 Zampen Public Briefing. Hatid po sa inyo ng Philippine Information Agency, Mindanao Communicators Network, Mindanao Cable Television, e-media at iba pang mga media organizations. Mapapanood po ninyo ng live ang ating Bantay COVID-19 Public Briefing sa PIA Western Mindanao Facebook page at pati na rin po sa ating mga cable televisions. Live po tayo sa Mindanao Cable Television and of course sa e-media po and e-media mo Facebook page. Ngayong araw po magkakaroon tayo muli ng update on the COVID-19 status sa ating Zamboanga Peninsula po and of course at makakasama rin po natin ang Department of Education. Makakasama natin si Regional Director Isabelita Bores para magbigay po ng karagdagang impormasyon patungkol po sa pagbubukas ng pasukan ngayong August 24. So ngayon po, kumustahin muna natin ang mga kaso po, ang status ng ating COVID-19. Doc, makakasama natin si Doc Dennis Dakayanan po. Doc, kumusta po ang ating case ngayon sa buong Pilipinas po and of course sa ating regional data po?
Hospitals po natin at ng local government units po natin sa ating region, nasa 8,510 na po na mga cases po. Either po suspect, probable, or confirmed cases po ang mga ito. Sa kabuuan po, ang suspect cases po natin ay nasa 7,600. Probable cases po natin, 0. At ang confirmed cases po natin ay nasa 910. Tingnan din po natin yung saan po ba nakikita yung mga cases po natin at ang ating mga recoveries. Pinakamarami pa rin po ay nasa Zamboanga City. Ang mga case recoveries po natin, mas marami na po ang mga recoveries compared sa mga active cases po natin sa Zamboanga City. Nasa 377 na po ang ating mga case recoveries po sa Zamboanga City, samantala yung active case po natin ay nasa 339 po. Sa buong region po natin, ang total recoveries po natin ay nasa 488 as compared po doon sa mga active cases po natin na nasa 396 po. Ang deaths ulit, nasa 26 pa rin po tayo. Ito naman po ang datos po mula po sa Regional Epidemiology and Surveillance Unit, ang aking pong unit sa Department of Health. Ito po yung kabuuan pong tally po o report po namin noong August 10, 2020 sa lahat po ng specimen po na na-receive po ng Regional Epidemiology and Surveillance Unit. Ang kabuuang total po ng specimen po namin na na-receive noong araw na yon ay umabot po kami sa 403. Ito po ay, majority po ay nanggaling po sa Zamboanga City Health Office, nasa 180. Sinusundan po ito ng Zamboanga del Sur IPHO. Sumunod po dito ay ang Zamboanga Sibugay Provincial Health Office at ang City Health Office po ng Lamitan sa Basilan. Samantala po, may naiwan po na 53 po na mga remaining specimens po sa RESU dahil po na-receive po namin ito either po pagkatapos na po ng ating cut-off, alas 3 po ng hapon sa RESU, o di kaya kulang pa po yung mga forms or ang mga documents nito para ma-process po sa ating laboratory. Ang 53 po na ito ay pinoproseso na po ng aking team para po madala po ngayon sa ating mga sub-national laboratories po for testing. Ang 403 po na na-receive po namin at na-proseso sa RESU noong August 10, 2020, dinala po namin ito sa CCMC DA Satellite PCR Laboratory. Tingnan rin po natin yung mga results po na nilabas po ng ating tatlong laboratory sa buong region po natin. Sa kabuuan po, meron po tayong 383 po na mga specimen na na-test noong August 10, 2020. Majority po ng mga na-test po natin ay galing po sa Zamboanga City Medical Center, Department of Agriculture Satellite PCR Laboratory. Umabot po tayo ng 295 po na specimens po na na-test po ng DE Laboratory po natin. Titingnan rin po natin yung datos, umabot po tayo sa 30 ang mga nag-positive po ng mga specimen samples sa ating tatlong laboratory. May 10 po tayo sa Gene Expert Laboratory na nag-positive for COVID-19. Sa DA Satellite Laboratory po naman natin, meron po tayong 11 specimens na nag-test po ng positive po for COVID-19. At sa Ciudad Medical Zamboanga PCR Laboratory, meron po tayong 9 na mga specimens na nagpositibo po sa COVID-19. In totality po, ang positivity rate po natin sa lahat po ng ating specimen noong August 10, 2020 ay nasa 7.8%, samantala ang negative rate naman po natin sa lahat po ng specimens na test po natin ay nasa 92.2%. Yan po ang pinaka-latest po natin na updates pagdating po sa COVID-19 surveillance. Makikita niyo po ang mga datos po na ito sa aming Facebook page po sa Zamboanga Peninsula Center for Health Development. Ma'am Myra?
Thank you po, Doc, sa ating update ngayong araw, or that's as of August 10 po, Doc, no? Okay. So,
Yes, ma'am.
thank you po, Doc. So, ngayon, Doc, marami po tayong mga katanungan mula sa ating mga media partners. Una po, mula kay Shokim Paler of TV11. The government has an allocated budget of 2.4 billion pesos for the COVID vaccine. Meron po bang allocated amount for Zampen?
Yes. Actually po, pag nagbabudget po naman ang ating national government, kasama po ang lahat po ng rehiyon sa ating bansa. So, doon po sa budget po na yun for our vaccine na pinopropose po ng ating national government, kasama na po ang Zamboanga Peninsula po doon.
Okay. That's good news po, Doc. Maraming salamat po. Next question naman po mula kay Ma'am Julie Alipala of Inquirer. How many contact tracers certified by DOH all over the region?
Yan. Mayroon po tayong umabot po na 1,186 po na mga teams po ng contact tracers na organized po. Samantala yung na-train po natin dito, umabot po tayo sa 1,514. Sa kabuuan po iyan na datos po sa ating rehiyon po ng Zamboanga Peninsula.
Thank you po, Doc. Next question naman po. Again, follow-up question from Ma'am Julie. May we request breakdown of contact tracers? Meron po ba tayo for Zamboanga, Pagadian, Dipolog, Dapitan, Isabela, Zambo del Norte, Zambo Sur, and Sibugay?
Yes. I-mention ko lang po yung mga contact tracing teams po na na-train po natin ng Department of Health at ng local government units po sa buong region. Sa kabuang total po, meron po tayong 1,514 po na contact tracing teams na na-train po natin. Ang 901 po dito ay nasa Zamboanga del Norte, 591 po ay nasa Zamboanga del Sur. Ang Sibugay po, meron po silang 16 na contact tracing teams po na na-train. Ang Zamboanga City po, may 3 teams po na na-train po ang Zamboanga City. At ang Isabela City naman po ay may 3 teams na na-train po for contact tracing.
Okay. Thank you, Doc. Last question from Ma'am Julie. Why do you think number of cases in Peninsula consistently increasing?
Dahil po ito sa sinasabi po namin ng mga nakaraang interviews po natin at sa nakaraang pong kapihan, tumaas na po yung ating testing capacity po sa ating mga laboratories. Mabilis na po ang ating results. Wala na po tayong backlog sa ating laboratories po. So, mas mabilis na po nating nadidetect ang mga bago pong kaso ng COVID-19 sa ating region.
Doc, as for the testing kits naman po, do we still have enough? Hindi pa naman po tayo nagkukulang for the testing kits?
Yes. Dumating po yung supplies po namin ng mga testing kits po sa ating PCR laboratory po sa DA. Sakto pa naman po ito, naka-budget po ito for the next quarters po ng 2020. Kung mayroon pong kakulangan or maaaring maliit na po yung ating supplies, nagre-request po ang ating regional director na si Dr. Emilia Munisin po sa central office para po mabigyan po tayo ng additional allocations po coming from the central office po at ng Research Institute for Tropical Medicine.
Thank you, Doc. Next question po, Doc, from Antonio Manaytay of Mindanao Sun. Can you forward to DOH 9 regarding the following complaints that even vehicular accident victims would undergo an RT-PCR test? It is alleged that this practice of classifying COVID-19 case is for the hospitals to make money. Hope our health officials will consider this query.
Yes. May mga ganun pong reports. Actually po, ang ating testing po for PCR po for COVID-19 ay magbe-base po yan sa assessment po ng ating physician. Kung ang physician po natin ay nagko-consider po na baka the patient or the case po na nasa emergency room po natin ay baka COVID-19 suspect po ito, we run the test po. Depende pa rin po ito sa assessment po ng ating mga doctors at ng ating hospitals. Pero sa mga ganitong report po, we conduct investigation naman po kung may mga ganito pong kaso. But for now po, we trust the assessment po ng ating mga doctors sa ating hospitals kung magre-request po sila ng RT-PCR testing po for COVID-19.
Thank you, Doc. Next question po from Ma'am Liza Hoxon. Is it true na may outbreak sa Zamboanga City Medical Center OPD or outpatient department nila? I received a report that at least 4 staff members got sick.
Yan. Ang ginagawa po kasi natin sa ating mga COVID referral hospitals, we regularly swab them for COVID-19 testing po gamit po ang ating PCR. So isa po sa mga measures po natin yan para mapigilan po yung pagkakaroon po ng infection sa ating mga healthcare workers. So ngayon po, may mga kaso po na naitala po sa Zamboanga City Medical Center ng mga empleyado po nila. Naka-isolate na po ito sa ating mga TTMF facilities na minaman po ng CCMC. Ang mga symptomatic po ay naka-admit po sa kanilang hospital, sa Zamboanga City Medical Center. Pag asymptomatic naman po ito, nasa amin pong TTMF po na minamanage po ng Department of Health at ng Zamboanga City Medical Center. So ito po ay routine po natin na ginagawa, ang testing po sa ating mga frontliners po pagdating po sa COVID referral hospitals po natin. So baka findings po ito ng ating regular testing.
Next question naman po, still from Ma'am Liza. There are many news about promising vaccines that have passed several phases of trials, such as the vaccine from China that is being tested in Abu Dhabi and also the Russian drug Avifavir. According to Senator Bongo, Russia wants to manufacture the drugs in the Philippines. Is this a reason for us to be hopeful? What is your opinion on this, and should we already plan our vacations in the near future?
Yes. Ako rin hopeful po ako na magkaroon na po ng bakuna sa ating bansa at sa ating mundo. Kasi parang ang COVID-19 na to, marami po talagang changes na nangyari sa ating mga buhay-buhay at sa ating communities. But ang stand po ng Department of Health, ang bakuna po ang gamot, dapat nag-undergo pa rin po ng proseso po ng accreditation at licensing po sa ating mga regulatory bodies po tulad po ng FDA. So lahat po mag-undergo po ng proseso na yun bago po natin i-implement po sa ating communities or ibigay po sa ating mga kapwa Pilipino. So we're waiting po na sana mas mabilis po ang pag-develop po ng bakuna at ng gamot laban po sa COVID-19 para makabalik po tayo sa ating normal life or dun po sa ating new normal. But for now, huwag po munang lumabas at magplano po ng bakasyon. Stay at home pa rin po tayo habang wala pa pong bakuna or gamot po laban sa COVID-19.
Okay. So of course, no, we are all hoping for that, Doc, na hopefully sana within the year we have the vaccine na po, yung effective vaccine for COVID-19. So, Doc, next question po. What are the most persisting challenges among LGUs, general public, social media that you encounter that make the fight against COVID-19 more difficult? Other countries and even some provinces in the country seem to have already contained the spread. But here there seems to be increase of cases on a daily basis. Any comment po on this, Doc?
Marami po talagang challenges pagdating po sa response po natin sa COVID. Marami kasing factors na i-consider po natin. Happy lang po kami sa Department of Health kasi po yung mga local government units po natin ay nakikipag-cooperate po sa ating campaign against COVID-19 kasama po yung iba pong interagencies po natin na members po ng ating Regional Interagency Task Force. Ang kailangan lang po natin gawin, sana po sumunod po tayo sa mga payo po ng ating mga local government units at ang ating mga line agencies pagdating po sa prevention and control measures po laban po sa COVID-19. Sa social media naman po, wag po sana tayong mag-share ng mga fake news at ng mga hindi po confirm po ng mga information para po hindi po tayo mag-create po ng panic at chaos po sa ating community. Ang hinihiling po sana namin na makapag-cooperate po ang lahat ng mga tao, especially po sa Zamboanga Peninsula, sa mga measures po na inilalatag po ng Department of Health at ng local government unit para maiwasan po yung spread at pagkalat pa po ng ating COVID-19 sa ating mga communities. Mamaya po, may mga options po tayo paano po tayo makakatulong sa ating response or laban sa COVID-19. Unang-una po, bawal pong lumabas nang wala pong mask. Pangalawa po, i-disinfect po ang ating mga kamay, gamit po ang sabon at tubig o di kaya gumamit po tayo ng mga hand sanitizers na alcohol-based po or gumamit po tayo ng alcohol rubs. Pagka tayo po ay i-maintain po natin yung hand hygiene po natin as many times as possible po during the day. Di po, dumistansya po tayo ng at least 1 meter po. Ito po ay isa sa mga means po para po mapigilan po yung pagkalat po ng COVID-19. Mas malayo, mas better po ang ating chances po na hindi po makuha ang COVID-19. At least po 1 meter or more po ang ating distansya or tinatawag po natin na social distancing. At ang A po, alamin po dapat natin ang tamang informasyon laban po sa COVID or anything information po na regarding po sa COVID ay dapat po nakuha po natin ito sa mga legit po ng mga website or di kaya ng mga agencies po ng government. Maaari po silang makakuha ng mga information po sa page po ng Department of Health, National Office po namin. Nandun po ito sa Facebook. Hindi po namin pinagbabawal na i-share po ang mga informasyon na nandun po sa ating Department of Health page po sa Facebook. Maaari nyo rin po i-share, i-like, at ipasa po ang mga informasyon na makikita din naman po sa Facebook page po ng aming Zamboanga Peninsula Center for Health Development Facebook page. Kasama rin po ang PIA Western Mindanao doon sa mga legit na mga possible sources po ng tamang informasyon po para regarding po sa COVID-19. Yun po ang mga pamamaraan po natin para makaiwas po sa COVID-19. In our own little way, makakatulong po tayo laban po sa COVID-19.
Thank you po, Doc. Last question na lang po from a concerned netizen. Nakaka-stress na talaga, lagi na lang pong bad news ang nakikita natin. Do you have any good news po for a change, Doc?
Yes, good news. Marami pong good news. Ang mabuhay po tayo ay good news na po. At ang ma-inlove po tayo ay good news na rin po. Yay! Pero sa ating COVID-19 response po, mas marami na po tayong recoveries compared po sa ating mga active cases po sa ating region. Karamihan po na nagpapositive po sa ating rehiyon ay asymptomatic or may mild signs and symptoms sa lamang po. Then hopefully po, the vaccines and then the medicine for COVID-19 will be developed in the next few months or early 2021 para po mabigyan na po tayo ng bakuna and chance po na magkaroon or malive na po natin yung new normal. Mamaya po, ipapakita rin po namin na ang Zamboanga Peninsula po ay naka-achieve po ng mataas po na accomplishment pagdating po sa polio outbreak response naman po natin o yung sa bayang patak kontra polio.
Okay. Good news po yan, Doc, no? Kasi amid sa COVID-19 pandemic dito sa Zampen, ay mataas pa rin po yung ating accomplishment rate on our other programs. So yun, agree po ako, Doc, na isang magandang balita ay ngayon, buhay tayo sa mga manonood natin ngayon, buhay and healthy, so we should be thankful for that. And good news yun para sa atin at para sa ating mga pamilya. Thank you po, Doc. With that, Doc, any thing pa po ba to share sa ating mga manonood? Like you mentioned, our accomplishments for Department of Health and of course po, message natin sa lahat ng mga manonood, our frontliners and homeliners. Doc?
Yes, maraming salamat po sa lahat po ng mga frontliners po na nagtatrabaho pa rin po sa abot ng kanilang makakaya para po rumispan po sa ating outbreak po ng COVID-19. Maraming salamat po sa mga homeliners din po natin at sa mga media partners po sa pagpapalaganap po ng tamang impormasyon tungkol sa COVID-19. At sa PIA, ang ating ever partners po, pagdating po sa pagsataguyod po ng tamang impormasyon po para sa ating rehiyon. As of August 10, 2020 po, mayroon for the information po ng lahat, ang accomplishment rate po natin pagdating po sa bayang patak kontra polio, umabot po tayo sa 96.82% sa buong rehiyon po ito. So nagpapasalamat po kami sa mga magigiting po ng mga barangay health workers, mga midwives po natin sa ating mga communities, sa mga nurses po natin, at sa mga doctors, sa mga barangay council po na nakiisa po. Kahit po nasa kalagitnaan po tayo ng COVID-19 pandemic, na-achieve pa rin po natin yung ating pong target. More than expected po. Pagdating po sa ating sabayang patak kontra polio. Ang nabakunahan po natin, laban po sa polio, ay mabot po tayo sa 549,013 na mga kabataan ang nabakunahan po natin ng ligtas, safe at effective po na bakuna laban sa polio. Our goal po during the campaign is to at least achieve around 95% po na coverage. More than po sa ating target ang ating na-accomplish for this round po ng ating vaccination campaign po laban sa polio. This is to ensure po na mayroon pong herd immunity po, lahat tayo laban po sa polio. We commend and express our gratitude and thanks po sa lahat po na nakiisa po sa aming mga campaigns, lalong-lalo na po yung mga local chief executives po natin, yung mga governors po natin, mga mayors po natin, mga councilors po at mga barangay council members, kasama po yung lahat po ng mga members po ng teams po ng local government units po natin, health workers po na maliban po sa lumalaban po sila sa COVID-19, patuloy pa rin po silang lumalaban para po sa mapigilan po ang pagkakalat po ng outbreak po ng polio sa ating rehiyon. Ang mga magigiting po natin ng vaccination teams na sumuong po sa init at sa ulan para lang po mabakunahan yung ating mga kabataan na mga targets po natin. Sa mga volunteers po natin, marami pong salamat. Kung wala po kayo, hindi po natin ma-achieve po yung ating 96% coverage po sa ating vaccination campaign po sa ating region. Buong puso po kami nagpapasalamat sa inyong tulong at sana po sa mga next campaigns po natin ay sama-sama pa rin po natin ma-achieve po yung ating pong targets at goal po na ensure po natin na lahat po ng ating mga population po sa ating region ay mabigyan po natin ng tama at maayos po na health services po para po sa lahat. Let us all make, we hope na we could end the polio outbreak in the next few months. So, salamat po sa inyong pakipagtulungan. Last August din po, August 5, 2020, ang Department of Health po, nagkaroon po ng launching po. Pagdating po, kasi po ang August po ay Family Planning Month, nagkaroon po tayo ng launching noong August 5, 2020. This is in line with the celebration po ng Family Planning Month po natin. Na ang theme po natin ay Stay Safe and Healthy, mag-FP. This is aligned with the continuous provision po ng essential health services po natin, tulad po ng family planning po amidst po the COVID-19 pandemic. So, in-encourage po namin ang lahat po ng health facilities, rural health units at mga barangay health centers na patuloy pa rin pong ibigay po ang essential services po natin tulad ng family planning services po kahit po nasa gitna po tayo ng COVID-19 pandemic. Isang paalala po sa lahat na mag-family planning para sa ligtas, malusog at wais na pamilya. Magtanong po sa pinakamalapit na health centers o healthcare worker po sa inyong lugar para po sa mga family planning methods na pwede niyo pong gamitin o yung mga family planning services na pwede niyo pong ma-avail. Ito po ay libre, safe, at maayos pong ibibigay po ng ating mga magigiting na mga frontliners po sa ating mga health centers. Muli, marami pong salamat. Remind ko lang po kayo sa ating bida solusyon kontra COVID-19. Ang B po, bawal po na lumabas ng walang mask. Ang I po natin ay isanitize po ang ating mga kamay. Gamit po ang sabon na tubig o di kaya ang alcohol-based hand sanitizers or alcohol wraps. Dumistansya po tayo ng 1 metro para po maiwasan po natin ang COVID-19. At ang panghuli po, ang pinaka-importante po dito, alamin po at spread po natin ang tamang impormasyon, ang totoong impormasyon tungkol sa COVID-19 para hindi po tayo mag-cause po ng panic at commotion po sa ating mga communities. Muli, marami pong salamat. In behalf of my Regional Director na si Dr. Emilia P. Munisimpo at ang aking Assistant Regional Director na si Dr. Joshua Brillantes, sa ngalan po ng aking team po sa Regional Epidemiology Surveillance Unit at sa Health Education and Promotion Unit po ng Center for Health Development, marami pong salamat. Together po, we can hail as one.
Thank you very much, Dr. Dennis Dacayanan of Department of Health. Maraming salamat po sa mga impormasyon na ipinapamahagi po ninyo sa amin weekly. Weekly po yan dito sa ating programa. So thank you, Doc, and see you po sa ating next Kapihan episode, maybe by Friday po. So see you po, and ingat po, stay safe sa lahat po ng taga-Department of Health Region 9. Thank you po. Okay, once again, that was Dr. Dennis Dacayanan of DOH 9 live via Google Meet. Thank you po, and samahan nyo kaming muli sa mga next pa po nating episode para sa update pa po on COVID-19. So now, we will proceed with our guest na po, but we will have our short commercial break muna, and later makakasama na po natin si Regional Director Isabelita Bores of Department of Education Region 9. Magbabalik po kami, wag po kayong aalis.
De Luna,
Present!
Herrera,
Present!
Valera.
Present!
Handa ba tayo sa school year 2020?
Present! Ngayong taon, ang edukasyon tuloy pa rin. Sa tulong ng DepEd, mga guro at mga magulang, ang handang isip, handa bukas. Tuloy-tuloy ang pag-aaral. May mga modules para sa iba't ibang antas. Sa government TV, maging sa radyo. Mahalagang ligtas ang ating mga estudyante at guro. Kaya kahit nasa bahay, tuloy ang edukasyon. Kung tulong-tulong, may paraan, may aralan.
Handang isip, handa bukas.
Bisitahin ang DepEd Philippines sa Facebook at ang deped.gov.ph.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
Beat the solusyon sa COVID-19.
Kaibigan, alam mo na ba kung anong dapat gawin upang iwasan at sugpuin ang COVID-19? Iwasang hawakan ng bibig, mata at ilong. Laging maghugas ng kamay gamit ang sabon at tubig sa loob ng 20 segundo. Linisin ang mga bagay na palaging hinahawakan. Kumain ng balanse at masusustansyang pagkain. Matulog ng sapat, huwag magpupuyat. Stay home. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin. Nasistress ka na ba? Nagpapanik o natatakot dahil sa COVID-19? Normal lang ang ganitong mga reaksyon sa ngayon. Pero may magagawa ka para mapagtagumpayan ang sitwasyon na ito. Ituloy lang ang pangangamusta sa mga kamag-anak at kaibigan gamit ang text, tawag o video. Tiyakin na ang mga bata ay ligtas at nasa maayos na kalagayan. Gawin sa bahay ang mga nakasanayan upang hindi mabagot o mabalisa sa panahong ito. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin. Kaibigan, huwag ka na munang lumabas ng inyong bahay, maliban na lang kung bibili ng pagkain o may emergency. Tandaan ang mga sumusunod. Kung kailangang lumabas ng bahay, magsuot ng mask. Siguruhing may 1 metro ang layo sa ibang tao. Magdala lagi ng alcohol o alcohol-based hand sanitizer. Huwag hawakan ang iyong mukha. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin.
Nagbabalik po ang kapihan na Zamboanga. At ngayon po makakasama na natin ang Department of Education. Magandang umaga po, Regional Director Isabelita Bores. RD, good morning. Welcome to our program po again. RD Beth. Pag-uusapan po natin ngayon ang mga pamamaraan po muli kung ano yung mga paghahanda sa ating Learning Continuity Plan on our opening of classes ngayong August 24. So kahapon nga nagkaroon po sila ng National Simultaneous Virtual Kick-Off po on their learning modalities. So kahapon po yun. So ngayon, pati ano po yung mga dapat paghandaan nga ng ating mga magulang at ng mga estudyante sa pagbubukas ng pasok po ngayong August 24, malalaman po natin yan. Although na-mention na po siya before, so kayo po baka may mga karagdagang katanungan pa kayo, masasagot po ito mismo ng Regional Director po ng DepEd Region 9. So RD Bores, good morning po again, live via Google Meet. Opo, wala po tayong audio RD.
Dali lang.
Okay na po, RD Beth. Can we greet our viewers po, listeners this morning? Do you have any message?
To our beautiful anchor, also to the staff of Director Noemi, and to the all staff of this TV station that everyone is listening to right now, and to all my colleagues in the government service, and to all my listeners, especially my teachers and my administrators, especially the parents. Buenos dias a todos. Good morning, everyone.
Good morning po again, RD. RD, first of all, we would like to ask, kumusta po? How was our national simultaneous virtual kick-off po? Kahapon, nangyari po ito kahapon ng umaga. Ano pong nangyari? Yeah. What is our update po on that?
Okay, there was some kind of a technical glitch that transpired yesterday. But yung preliminaries naman, as we were all represented by the chairman of the RDC of Region 9, Governor VQ, and also the very supportive mayor of Isabela City, si Mayor Dahiela Hataman. We were able to present a glimpse of what we have prepared, what kind of support that we receive here in DEPED Region 9. At the press con went on, but I know there was a lull period, no? May gap doon at that time because of some technical encumbrances in Region 12. Actually, yung host region was Region 12 yesterday.
Okay. So are we going to have another virtual virtual presentation po? Especially po here in Region 9. For orientation po sa ating mga parents and students.
I think it is done by division, and tomorrow is intended for the division of Zamboanga City.
Okay.
And I'd like to connect and coordinate with my Regional Information Officer, Dr. Dalia Paragas, because if we can tap also media, we can have another one by next week. But I'd like to find out the extent of the Handa Isip, Handa Bukas programs of the different divisions, kasi we allowed that it will be more at the division level because they can have a good reach in terms of the influence of the media that they are using. For example, we cannot get control of all the municipalities of Zamboanga del Norte, but if we'll do it in Liloy, the whole of Zamboanga del Norte will be covered, diba? On the other hand, in Zamboanga del Sur, you can have it in Mulabi, or if not at the center, which is Pagadian City, then the whole of Pagadian City and Zamboanga del Sur will also be covered. In other words, we localize the presentation and the orientation. But ngayon po, ang tutok per my assistance and instruction, tutok lahat ng mga division offices are, we call it the Parents Parental Support or Parents Forum, because our target is to reach to 100% of the parents whose children are enrolled in their school. So in other words, ma'am, ano talaga school level yung mga opening presentations that we do have in preparation for the August 24. Para one-on-one ang discussion about the learning modalities that we have. We already have realized during our dry run at simulation, kasi each division po may dry run. And one of the feedbacks is yung adaptability ng mga parents. So I give premium on the parental or the parents orientation, which they are doing up to August 18 of next week. Of course, side by side with that, kasi pag mag-orient ka ng parents, necessarily andun din yung mga teachers. So it presupposes already na ngayon si administrator or the principal has already good sharing with the teachers, and eventually teachers with parents. You could realize the bulk of the response.
Okay.
And we cannot have a good interpretation, consequently implementation of the learning modality pag hindi alam ng mga parents. Remember, ang blended learning is home-based learning. Nasa bahay po ang bata.
Thank you po. RD, as of now po, what are the challenges that we are facing, especially po sa Region 9? Ano po yung mga challenges natin, and how are we going to address po para all our parents will be informed on the learning modalities o yung mga ways natin on the opening of classes? Paano po siya?
Okay, so as I mentioned a while ago, the focus now, I said, we are putting premium now on the parents orientation. Kasi every week or every 2 weeks, iiba ang challenge. I would say last week of July 27, up to last week, August 7, the divisions were concerned about the preparation, the production, and consequently the distribution of the learning modules, which we call SLM, self-learning modules or modality. Yun. Now, I think we did with the procurement, because a week before that also, July 21, we already downloaded, and I can show you the amount downloaded, and it's about 400, almost 450 million pesos from central office money, from our government, that's our fund, downloaded to the divisions. Wala pong isang sentimo na naiwan sa region. Lahat po dinownload na namin. And then, so they can start with the production, procurement, because you know, you will be producing, ilan ang enrollment namin ngayon? 866,000 modules. So yun. And ngayon na the modules are already prepared, my arrangement with my superintendents is this week up to August 18, dapat tudo-tudo na yung mga parental in orientation, mga meetings, which they can do it either virtually or by group of 15 kasi we really have to abide with the DOH IETF health standards. Bawal po ngayon ang convergence of more than 20. So, they really have to regroup themselves para makausap. Kasi, I said earlier, very critical po yung understanding at support ng isang parents kasi ang bata ngayon ay nag-aaral sa bahay. Kaya kahit maganda pa yung module, pag hindi naman maintindihan ng mama or ni papa. But we cannot also have that type of forum pag wala din, hindi naman makita ni mama kung ano ang itsura ng module. So inuna namin, a month before, as early as June, the regional office even assisted in the writing up of the modules. So we have thematic modules, we have Division H initiated modules. Kasi sasakupin mo yung the whole competencies. Alam mo kami sa DEPED talagang may mga targets, ano ang lesson for the week, for the month. So sasakupin yun. So as early as June, Region 9 already prepared, started writing to support the division office about the modules. And then because we have gotten already the amount to be downloaded to us, so we prepared according to the allocation given to us. So pinag-iisipan namin yan. And then finally, as early as the first week of July, medyo ready na yon, we went into reliability test for the modules that we have, of course with the guidance also of the central office. Then when money was downloaded July 20, immediately within 24 hours, 21 or 22, we downloaded already the first tranche of 37 million pesos. And each division also received an amount as mobilization fund as 438,000 pesos. Para po mapakita na ang DepEd on its own was also helping. But of course, if you have also heard other comments like, and I doubt no kung nangyari ba talaga yan sa ating mga division offices in the region na nag-solicit. Siguro we ask help from the LGU. Siguro we have asked help from the local school board. Pero we did not let our administrators solicit from our own teachers. Kasi I considered it bawal. No? Nobody will collect from a teacher because we already provided the resources corresponding to the materials. But because DepEd has a connection with the local school board being the vice chair, and seemingly all our governors and mayors did help. Kaya marami talaga silang naibigay. Hindi ko na maisalaysay kung ilan, but they were given support like lithograph machines, they were given Xerox or copier, they were given bond papers, and even the ink, master roll, yung mga technical gadgets incorporated in production machine. And we would like to appreciate also our local LGUs officials who have also given support in terms of purchases of iPad, may mga tablets at saka mga computers. And more than that, and may I also highlight, si Governor Yu, for example, shouldered all the expenses for the grades 3 to 10 modules yung ginagagamitin namin ngayong August 24. Si Mayor Hatama naman ng Isabela City put up 3 channels. So 1 channel is for grades 1 to 4 para the whole day may klase na mapakinggan ang bata to support what is in the module. Another channel for grades 6 to 8, then 9 to senior high school, isang channel. And there are also LGU supporting the use of radio-based instruction. I think in Region 9, in Zamboanga City, you have Tridia, RMN, Radio Marino, at Radio Pilipinas. Yun yata ang nakakontract with the DepEd Division of Zamboanga City. And on the same note, Dipolog has one. As many rather, Dapitan has also a radio TV instruction. Zamboanga Sur and Pagadian City, meron din sila. And then, as I mentioned, even in Zamboanga del Norte, there are municipalities na nag-put up ng radio station. In Sibugay, we have Naga and CI. I could remember Liloy, Rojas, Sindangan, Zamboanga del Norte. I could remember Aurora, Molabid, Tukuran, and Pagadian in the case of Zamboanga del Sur. Yun na po yun ang mga assessment natin for the preparation.
Thank you po, RD Beth. We have question po from our media partners. Let me read po. First is question from Ma'am Letty Melitante of Zampen Journal. Tuloy po ba ang class opening sa August 24? Are schools ready, particularly the teachers? Do they have the necessary materials like the modules and among others, considering some schools were recently affected by the heavy rainfalls such that materials to be used like bond paper were damaged? So any comment or answer po on this, RD?
Tuloy po talaga. Unless may pronouncement si Presidente or unless may announcement or pronouncement din si Secretary Briones. But pwede ako magpakita ng a few slides para mapakita doon na no less than the RTC Chair, Governor VQ, and also si Ma'am Bing Climaco last August 4, last Tuesday. Nagsabi din siya na all of them are supporting the opening on August 24. Pero may condition po yun. In case merong presidential announcement, we will not proceed. In case may mangyari na talagang matindi in any part of Region 9, like for example, boom yung sa Zamboanga City, but let's congratulate DOH for doing their job. Tsaka yung mga containment procedure, including isolation. Pag magsabi si Mayor Bing, we will let the mayor and the governor tell DepEd for the particular province or city. Wag muna ngayon kasi like in the case of Region 3 and NCR, they are moving 2 weeks after kasi nag-ECQ na nga sila ngayon or MECQ. On the other hand, in our region, pag sabi ni Governor VQ or ni Governor Vic, Governor Robert Oy ng Norte na, ay hindi talaga ready for August 24 because of this. We will abide with the IATF. But we have also assured them na ongoing na po ang mga preparation. And I think we have already produced 50% of the materials. As I mentioned, a historical account of the focus that we have given in terms of the preparation. So gumagawa kami the whole month of June. Ready na yung mga materials for July. Nag-download kami ng 3rd week so that following back procedures sa kuha natin na we just could not produce without abiding policies of the Commission on Audit. May mga procurement procedure which will take 2 weeks and then at most 21 days from purchase order to approval of back kasi all of these are government funds. Taxes po ito ng mga kapwa natin Filipinos, atin. Kaya it should really go through the process para may transparency and integrity. So ando na yung pera, yung second tranche intended for the second quarter. Kahapon, we just released a total of 420 million for all the divisions. And I can show you a template also for the different resources downloaded to the divisions because sa regional office po, we really ensure updating in terms of database.
Thank you po, RD. At RD, can we proceed po ba sa next question po from our media partners?
Come again?
Yes, let's proceed po sa mga katanungan from our media partners po. We have few more questions pa po for you.
Pwede kaya, what is the better way? I-present ko muna I'll just have to have 6 slides.
Yes, sure po. Go ahead. Opo.
Mabigyan din ng source of katanungan.
Yes,
diba?
Okay. Sige, sure po, RD. Go ahead po. You can present.
Sige, para doon kayo magtatanong. Okay. This is now the present enrollment. Pwede yan tanungin, 866,421 na po ang enrollment, which accounts to 86%. Last year po, we have 930,000. Imagine, no? 930,000 enrollees. So we have 866,422. Kung baga, 89% to more or less 90% pa ito. Meaning, meron pa po tayong mga bata na hindi pa nakapa-enroll. And then, marami po doon yung mga maliliit like grade 1 and 2. Siguro si mama may mga doubts pa o di ba naglangan-langan. Kasi we are still open for enrollment even up to next week. Kasi so long as we have not started on August 24, so we are still encouraging our parents. Paki-enroll naman if your child is already sa kinder 5 years old or sa grade 1 6 years old. We don't have kasi data sa kinder, kaya tsaka siguro may mga ability ng mga parents, but we have a different modality. But we are assuring you kasi mga takot. But sa elementary, at least we are shooting up. Pero alam mo, in terms of sa secondary, mas marami po yata ang enrollment ngayon ng junior and senior high school. Ito po ay public school enrollment. Kasi dumagsa or there are transferees from the private schools. Kaya ganito yung scenario. Okay, let me proceed. So, we would like to thank parents who have trust at DepEd. Nag-enroll po kayo, and sa mga bata na hindi pa nag-enroll, please enroll. Sayang din po naman yung 1 year. We're really trying our best. This may not be a perfect scenario for an enrollment kasi yung isip natin nasa eskwelahan, but we are trying our best with the home-based learning. And we really have prepared the modules. Okay, ito na ang summary of the learning modalities. So, makita mo ang isang division, ang next column, number of schools, then ano yung kanyang modality, yung nag-blend with TV radio, may pure SLM, o kaya yung pure online. Kasi meron din isang high school or some high schools na kumpleto na mga computer packages given also by DepEd in the last 2 years na in the past. And then yung iba, combination ng 1 and 3. So makita natin lahat dito yung modality. So marami talaga ang pure modules because these are the barangay or the non-central schools, yung hindi talaga makakaya yung maggamit ng computers. And then, ito na po yung kapirahan na na-download natin sa ating mga division offices to assuage some of the apprehension related to mga teachers daw hininga ng bond paper. Bawal po maghingi ng bond paper sa isang guro because we provided the materials. And then secondly, meron po tayong MOOE sa eskwelahan. Ano po yung MOOE? Maintenance and other operating expense. 30% po ng MOOE ng eskwelahan gagamitin po sa learning modalities. The other 30%, if you say for example 1,300 pesos, i-donate nga gamitin for the modules, pag 1,000, but mga eskwelahan ngayon marami po silang malaki-laki yung kanilang mga MOOE. Yung isa, 30% is for the health gadgets po, ma'am. Alcohol, face mask, thermal scanner, and all others and washing facilities. Each school is given an amount, depende po yun sa enrollment, per month. And we already have instructed with the coordination of the regional office, instructed the superintendents. Yung May, June, July, aayusin na yung mga pera. We have not yet started with the schools. Ang MOE talaga, there's already a memo on that. Walang ibang bibilin except for the modules and for the learning gadgets. Of course, overhead cost po yung naiwan na 30% or 33%. Ano yung overhead cost? Water, light, may mga maintenance po tayo. And sometimes meron po tayong maintenance for some security guards. Doon po kukunin yun. So not na bahay na 30 or 33% to make up the 100% or 30, 40%. So 30% modules, 30% hand washing or health gadgets. Then the other is for the overhead cost or operation of the school. So ito, I may end up with this slide quickly. So we issued already a memo 140 last week. And then we're saying to answer the question on the opening, we have gotten a support, a resolution from the Regional Development Council, and even the support of the chairman of the Regional Peace and Order Council, Mayor Bing Clemaco of Zamboanga City, in which we have also our all virtual conferences. So ito na po yung kabuuan. Meron na kaming standard for health protocols. Meron na pong schedule ng enrollment. Kaya ito po, ma'am, is pag-uusapan talaga doon at the level of the parents in the school. Paano para to avoid congestion at of course contamination. Meron na po kaming mga schedule for going to school on August 24. And I hope this is dealt properly by the schools division superintendent. Meron po kaming schedule ng work arrangement of our teachers. So Monday po sila magpunta. Depende po sa klase ng eskwelahan kasi pag marami pong enrollees, baka yung distribution ng modules baka 2 araw. But certainly, ang mga worksheets will be submitted on Thursday. So ito yung gagawin niya. So meron din po kaming parang allowance for the teachers to parang to take a rest para sa wellness program like Tuesday and Wednesday. Then Friday po, we have an ongoing staff development program generated from our or derived from the central office. So continue po yung aming lock session. But then again, we also have provided a model kapag malaki ang numero ng mga teachers in school. So mayroon kaming model A, model B, model C. Because we have big high schools like your own Zamboanga City National High School, pati yung Zamboanga West. Ang daming mga guro doon. So we are advising administrators na i-regroup. Okay, ma'am. Ito po yung kanilang mga modalities. Ano ko na lang. I do not need to dwell on this, pero nakaready na po yan lahat ng mga modules. And then to my teachers, ito, and may I thank for this opportunity. For teachers who are listening now, there has been a CO-related type of a weekly home learning plan. Para bang lesson plan, pero the regional office modified it na simple lang para naman to help you out. And they are also to make their own individual learning monitoring plan. Ito kasi talaga gawa namin ito as a teacher. Gagawa kami ng lesson plan. Wala na pong lesson plan but weekly home learning plan. At meron na po tayong model para hindi na po maraming ipirma si teacher doon at isulat. And also with a Q1 LNP plan which have helped it. So finally, ito yung aming memorandum na talagang gagawa ng parental support. Maraming challenges. If you are asking me, ma'am, ano po yung mangyari sa home learning plan? Very challenging po yan. And if you're asking us about that, that really is the challenge now with an ongoing parental support. Kasi ang tanong namin ngayon is, ano kayang mangyari pag wala doon si mama sa bahay kaya nagtatrabaho? Yun. Ano ang gagawin pag wala naman siyang mga kapatid kasi seemingly tutulong yung kapatid. Isa-isa po yan ang mga modalities na pag-iisipan ngayon ni teacher advisor at si principal. And we also have issued to them ano yung mga different approaches to have those. In fact, we already have opted sa mga LGU, pag meron pa po silang pundo, we can even hire mga teacher volunteer to make some follow-up. Or we call it mga tutorial approaches. We have already gotten a good feedback from the LG of Dipolog City. Willing po doon si Mayor Darrell mag-hire to support para ma-follow up, lalo na po sa grades 1 and 2 at saka sa kinder. But we entrust the decision and the approach to the principal kasi alam mo, hindi naman lahat ng guro fully loaded on Monday or Tuesday or Wednesday. So that work arrangement can be done at the school level. In other words, sa Bisaya, magtinabangay sila dito because certainly in the distribution of modules, hindi lahat doon magpunta. Hindi lahat magpunta. Yun lang talaga may teacher advisories. Sa school kasi ma'am, meron kami mga relieving teachers. Relieving, meaning departmentalized po yun. Merong teachers who really handle English, wala siyang advisory. So ang mag-distribute talaga yung mga advisors. So that's the mechanism that we are doing. And we already have told the superintendents that principals should really post. By next week, ma'am, i-post na yung mga schedule and then sino yung class advisor, saan kunin, at also mapping. Pagpasok niya, kasi we should provide signages and markers. Pagpasok niya, saan siya pupunta para guided, including the grade level. I hope this can be worked out, but we need the help of media for an announcement, and we need the support of the barangay captains, we need the support really of the parents to understand. So yung August 24, sabi mo anong challenge? Kasi baka meron diyang parents na not well informed, baka magreklamo siya. But certainly sabi ko, magkalma lang kayo. Things can always be arranged and can be explained. Kung hindi niya alam, di alamin, bigyan siya ng sapat na informasyon. Otherwise, you really would campaign for more advocacy and information ngayon hanggang August 24 or August 23. Salamat po.
Okay. Thank you po, RD. Once again, thank you po, RD Boras. Thank you for clarifying po no, sa ating mga viewers on our process po to inform especially our parents po on our learning modalities. RD, we have a question po from our concerned netizen po. Ang tuition po ba sa private elementary schools is still the same?
Ang DepEd has external supervision sa mga private schools. Nasa batas po yun. We cannot influence them on increase of tuition fees. Pero ito ngayon, pero ang approval, regional office, okay. We only have a limited, may ceiling yan pag mag-increase. The most that they can go is 10%. But we already issued a regional advisory, June pa yun, huwag mag-increase. Huwag mag-increase. Pero kung may naka-increase before June yung advisory, siguro mga less than 10. But we're advising them, huwag mag-increase because we are in a crisis. And then, truthfully, ma'am, alam mo, we have 108 private schools. May nag-apply na nga ng temporary closure. I think we have 16 all over Region 9. 16 private schools na nagsabi mag-temporary closure. Siguro nahirapan din sila mag-increase o wala kayang enrollment. So yung increase po, we already said, walang sanang increase, but for yung na-aprobahan namin prior to July, baka may na-process. But certainly, they did not exceed, siguro yung iba 5% to 10%. Yun lang po. I cannot memorize. Siguro I can email to you the data of the schools na nag-increase. Pero konti lang po yun, ma'am, kasi naagapan namin. Kasi kung nakapirma kami, nabawi. But for sure, that school also a process of conscientization, baka nag-withdraw din siya ng implementation, yung approve increase niya. Pero we already have said walang mag-increase this year.
RD, kung wala pong increase, no, sigurado rin po ba na, or meron po bang hindi din bababa yung tuition kahit wala pong face-to-face classes or interaction? Or mag-maintain lang talaga po, RD, ang tuition fees?
I would say nga parang discretion na yan ng school administrators. As I was saying kasi kanina, di ba, sabi ko, finance management, wala po kami dyan kasi kami parang curriculum external supervision lang yung aming ginagawa for private schools kasi they have their own jurisdiction. Magandang tanong yan, no? Baka kasi wala namang face-to-face, bakit parehas na magbaba? But I will also answer this, the other perspective. Kasi yung tuition po ay bayad, yun ang source ng sweldo ng teacher doon. Kawawa naman yung mga teachers doon. And they were given salaries even June, July na walang klase. Hindi pa sila ng kolekta. We could also commiserate or sympathize with the scenario, with the plight of our private school teachers. Kaya po, at our end, meron din pong pera ang binigay ang DepEd. We call it yung ASC, yung Service Contracting Scheme, at saka yung voucher system ng senior high school. We downloaded already the funds at hindi po nag-deduct as is pa yun. For example, if that school was given an allocation of 100 pupils under the voucher system ng senior high school, yung dinownload namin for this year, kahit we did not have the final enrollment, pero the same amount was given. Yun po ang ginagawa ng DepEd ngayon. So, I don't know sa decision ng magbawas, but try to look at this yung tuition fee na yan is, I'm sure, is the source of the salary also of the teachers who were given salaries despite wala silang klase. May we just support also the private school group the way they have, kasi iba po yung sa private school, ito yung sa DepEd. Kahit na po yung aming na-download na mga modules, and they are also preparing modules, we give them even the template na if they could they need assistance, they can ask from the regional office. Pero yung pag-produce ng modules at their own expense po, kasi bawal po naman magamit or mabawasan yung dinownload ng DepEd to the division office and then mabigay doon sa private schools. COA will run after us kasi yun po talaga is for the public school system. I hope na tulungan kita sa sagot na yan.
Yes po. Next question naman po, RD. From TV11 po, this is from Shokim Paler. Tuloy po ba ang face-to-face classes this August? And meron po bang assistance na matatanggap yung mga pamilya na hindi kayang matustusan ang pag-aaral ng kanilang mga anak because of pandemic?
Wala po kaming mga social amelioration fund sa DepEd. So, wala po kaming maisagot for mga financial assistance. Pero ito lang, each learner will receive a module. Sinisiguro po namin yan sa lahat ng mga divisions, and I know all our superintendents have not been sleeping anymore because ang standing order ko talaga is be sure that you have a complete set of modules for all the learners. Wala pong manghiram-hiram. They kumpletuhin po because funds have been downloaded already at your end. Pero ngayon, kung ano man ang marinig din sa Zamboanga City, allow them to make some comments. Hindi pa naman po in klase ngayon. We still have, today is still August 11. Kung may mga kakulangan, sigurado pa yan this week because the finality of the production naman is up to August 20. Pero I know they are doing and moving heaven and earth, so to say, to produce those modules. Meron tayong programa sa DSWD, yung Pantawid. Yung Pantawid, again, is 100% support without deduction. So yung mga parents who are under Pantawid, they will receive. And then we are saying na ikumpleto yung assistance and we will make a follow-up in terms of the enrollment kung sino yung mga bata na na-enroll because part of the accountability ng Pantawid Plan is the enrollment of the child in the school. Kasi nasa batas yan. So ma'am, sa tanong, kung assistance sa parents sa mga Pantawid meron. Pero from DepEd, wala po except magbibigay po si advisor o si principal ng alcohol pagpasok niya doon. Magbibigay po kami ng mga facial mask for the teachers and also their own disinfectant gadgets. Yung modules po, libre. Yun lang po, mga mama at papa, wala na po kaming may bigay kasi we also have our own financial challenges when we produce the materials in school.
And we would like to clarify po, RD, that no face-to-face classes po no on August 24.
Ito. Now you have the schedule, Ito po yung mangyari. Mag-distribute po ng Lunes. So, ang Model A for a small school, Model B. Bakit 2 hours? Kasi mag-social distancing po sila, di ba? Linya-linya. And then, 1 meter ang distansya. That takes time, no? Pero mag-distribute po doon. Yung first 15 kasi sabi namin i-distribute sa classroom, ipakita. Kasi sa August 24, syempre, may mga birth pains po tayo. First time makita ng bata, tapos first time niya makita si teacher advisor. We allowed 15 minutes interaction, yung magpakita lang ba na ako po, si Teacher Lily, ganito po yung gagawin. May explanation po kasi hindi naman pwede i-diretso lang, hindi yan maintindihan ng bata. So, that's the limit that we have. Then they go home. May kami signage where they go out kasi may exit, iba yung entrance, iba yung exit para walang contamination naman among them giving entrance. So, wala pong wala talagang, I don't know, no? Siguro limited face-to-face yung sa distribution. Pero wala pong mangyari na face-to-face class doon sa eskwelahan. And then we also have restructured classroom na 15 seats lang po doon. Kung ang pag-distribute is one by one ni teacher, o di ba kaya ipapunta niya yung bata. Para naman na-check din niya na ito pala si Jose Santa Maria. Makita naman yung mukha kasi first time yun. But for sure, mag-improve kami ng mechanism after 2 weeks kasi madali na lang yan. Kukunin na lang ang module siguro sa labas, sa drop box, we call it drop box. So ganito yun. So wala talagang face-to-face if you're talking about a teacher talking about the subject. You see the schedule. Ito yung sa kinder, for example, pag maliit ang in a school with 500 pupils, nagsabi kami 7:30 to 9:30, grade 1 to grade 3, 9:30 to 11:30, ang grade 4 to grade 6. Pero ito po, magbabago din yan, depende sa enrollment. At saka baka may maliit din yan na bata. Kaya we did some dry runs, kayang mga simulations, so to say. And I advise all the superintendents kung pwede lahat ng eskwelahan mag-dry run. Para ano mo yung time motion study, yung pagpasok, paglabas, makuha mo yung element, then pag-distribute. Because that's very critical po sa mga simulation. How long it will take them. Supposing yung enrollment niya kung you combine kinder grade 1 and 3 more than 500 o kaya less than 500. So may flexibility din naman yun. But the point is, i-group namin or i-cluster ang mga bata para hindi po mag-congest, mapuno yung eskwela ng mga bata. And then may arrangement po kami sa mga classroom para walang hawaan. Di sila magkita-kita. Kaya we prepared the rooms also with 15 chairs. Pinalabas yung iba para kung magpasok kasi kawawa naman yung bata magtayo-tayo for more than 30 minutes. That's too much also. Makaupo lang naman siya pagdating sa school. So paupuin din namin siya. Then mag-distribute. Then after mag-distribute, mapakita a little explanation of 15 minutes. Pwede na po sila lalabas. In case merong anak na maliit, ayaw ni mama kasi bata pa, hindi pa siya independent. Pwede po samahan ang grade 1, ang grade 2, ang kindergarten for sure ng isang mama or papa or a sibling, a brother or a sister. Pero we will still go through with the process of thermal scanning, alcohol, social distancing, and then kung merong mga nangyari doon, soap and water as a health gadget have also been asked to be prepared by the administrator. Lalo na po din yung aming mga teachers na facial mask. Ang lahat po ng bata mag-facial mask. Kaya we are also advising, pagpunta doon, sana nagbili na rin si mama o nagpatay. Kasi we also have mga washable na mga facial mask. Pwede naman niyang gagawin. In fact, we have other alternate like mahaba na handkerchief, di ba, kung hindi talaga siya nakakuha o nakabili, or anything na mailagay niya sa kanyang bibig at saka ilong to keep track or in keeping with the health standard ng facial mask or face shield kung ano yun. So yun po. So si mama muna ang maglagay kasi alis ang bata. Kung ano ang arrangement ng aming principals kung makadistribute din ng additional baka next week na yan para may support mechanism because we allowed from the MO of the schools facial mask, alcohol, disinfectants, sanitizer and everything including water, toilet tissue and soap na maibili nila in preparation for the opening of classes. So ma'am, kung yung tanong ng preparation for the opening in terms of financial wala po except support from the parents. Meron kami, nasa eskwelahan na po yun. Ito yung pag-distribute, ito din yung pagsauli. So meron din kaming schedule for pagbalik ng papel sa Thursday. Dito, pwede na po kasi drop box na, wala nang pasukan sa eskwelahan. Ang mga drop box andyan sa gate or sa labas. Then i-drop na lang ng either the mother or the pupil or kapatid niya kasi may mga signages yung boxes. Like for example, grade 1 section Santan, ando na, grade 1 section, grade 2 section Molabi. Kasi nagkita-kita na sila, di ba, that Monday. So hindi na po needed ang presence ng bata. Then, but we require our teachers to report on Thursday and Friday. Sa Wednesday po, parang we don't allow them to go to school anymore para makarest naman sila for all the hassles during the distribution at saka yung mga follow-up. Because we still say, baka meron ma-misinform, we have Monday afternoon or Tuesday morning na pwede naman using their own initiative, maka-follow up din si teacher kung nasaan na yung bata, baka may problema, hindi nakapasok. So, pwede naman niya ihatid yung module using again social distancing. Ito, mga localized arrangement na po ito, ma'am, which are also to be discussed during their parents forum. So, may mga PTE or parents forum po tayo nangyayari ngayon by school level, by class level. Salamat po.
Thank you po. RD, we have last question na po para ngayong araw. Meron bang possibility na ang mga parents na lang yung mag-a-answer sa mga worksheets ng bata? Is the DepEd prepared to address this? And what if po kung yung mga parents po natin ay no read, no write din po. So how can they teach or guide their children?
Okay, thank you for that very good question which I answered partially in my other explanation for the different question. Ito, okay. Ito, matuwa ka, ano, kasabi kasi ng isang nanay, kasi we already have mga feedbacks. Paano ako magturo, ma'am, grade 5, grade 2 lang yung tapos ko. Yun, walang magtuturo. So, ito yung mechanism na ginawa namin, di ba? Sabi ko kanina, pwede si teacher maka-visit per request, kasi alamin naman niya ngayon ano ang EQ ng mga mama at saka ano ang modality, kasi what if the parents are working, in which is really a common scenario, yung nagtatrabaho si mama, nagtatrabaho si papa. So ito ngayon, because we are saying na ang pagbasa ng bata is from, meron akong napakita kanina yung home learning plan, 9 to 11, then 2 to 4. Bakit 9? Kasi we expect na isa lang ang lamisa sa bahay, no? Sa dining table. For sure, yung 7 to 8, yun ang gagamitin nila for breakfast. Kaya ginawa namin 9 to 11. Mga ideal scenario yung ginawa namin. But this can be changed kung maaga pala sila mag-breakfast. Mag-start na ng 8 ang bata magbasa at sagutin yung mga tanong. And then sa hapon 2 to 4 at 11 why? Kasi alam namin na maghiwa-hiwa na naman for the food or the bayan to be prepared for lunch, di ba? At then mag-lunch din sila doon. We seldom have a family siguro, houses, except the rich ones, no? Pero sa public school, bihira po na meron talagang study room. Walang study room ang ating mga bahay, even at teacher's house. What we can do is the table in the sala or the living room or the table in the dining room. Kasi hindi man maganda magbasa siya sa kama niya. Dapat we should also inform them na ito yung proper way of reading kasi masira din ang mga mata. And in fact, we also have protocols or standards for viewing kasi meron ding iba na nag-apply ng TV viewing na every 1 hour dapat mag-rest siya ng 15 minutes. Meron po kami mga accompanying annexes sa mga memorandum na pinalabas namin. At hindi po sana pwede na hanggang 4 hours din siya mag-upo. So the most that we did advise is 2 hours. At most pwede 3 hours. Pero bawal na po yung 4 hours kasi that's too hectic in the part of a learner. And we should also say that ang bata is playful at home. Hindi naman natin siya bawalan maglaro because that's his only enjoyment. After all, stay home po siya. Nakakaloko din talaga. May see the word, no? Nakaka-stress din yung nasa bahay ka, and they have been there for a number of months, 4 months na sila nasa bahay. So we allow them to move and go around the house, diba? So yun. So kami, ma'am, as I mentioned kanina, this is still under negotiation, but we have also, I already issued a memo. Last part yata yun ng memo ko. Ito yung ginawa namin, ma'am. Pwede po learning support, parental support, ito. The division office may explore the possibility of volunteer workers to support ito sa baba. The division office may ask LGU, ito, last part po ito, kung meron pong pera, Ito, ma'am. The last part na makakuha sila for some what we call family volunteer. Nangyari ito, ma'am, sa not only in Dipolog but also in Isabela. Meron silang ginawang parang may mag-ikot. Pero volunteer po ito and we cannot charge it from the DEPED funds kasi wala po kaming pera. But they can ask from the local government school board funds. Pwede po, allowed po yan namin. And then I think to you, LGUs already committed for that. So may I answer that, either teacher volunteer, meron po kaming parang parental focal person na mag-ikot to help. Pwede rin po si teacher. Kaya if you notice yung schedule namin, Monday siya mag-distribute. Nilagay talaga namin na Tuesday, Wednesday, open siya. Open that she can do. But they have to coordinate with the barangays kasi ito na naman, depende sa issue ng COVID case, seemingly wala naman pala tayo. Thank you DOH for the information. Makaano po siya, makakandak ng home visit. We allow that kasi ito na, strengthen namin yung home school partnership para mabigyan siya ng a little bit of tutorial, especially ma'am, for kindergarten at grades 1 and 2. In fact, we allow yung clustering. In our annex memo, cluster, tibo-tibo ba? Like, kung magkatabi-tabi lang yung mga maliliit na bata, pwede naman siya doon, a group of 5 for some questions that cannot be answered. Then, answer to the first question. Ang masama, hindi naman masama, no? Ang question is, si mama na ang mag-answer. Ang mag-tutor talaga si mama. Siguro ito, lapin, I am also a grandmother. Sa kasagaran ng pagbasa ng bata, may maitanong siya, tapos hindi niya alam, there are really cases na makatulong ang mama magsagot. But we see to it na, especially yung grades 3 to 10 na thematic modules, kunti lang ma'am, 2 pages lang yung pinasagot-sagot namin. Kasi yung other question na binigay namin is something doable. Yung bang magawa ka at ilista mo yung tanim na nasa likuran ninyo para to encourage home gardening. So hindi po lahat pencil and paper question. Meron po kami mga performance or project type na na-introduce din doon. Pwede ba magtanong sa lolo kung may lolo or auntie or wala, kung sino na lang yung nasa bahay, ng isang kwento. So yun ang mga variety of questions that we are asking. Hindi po yung talaga tudo-tudo na enumeration type or question type, interrogation type of performances. We also consider some performances, mga portfolio, we call it portfolio assessment. I hope I have answered the question. So kung makatulong si teacher o kung si parents na ang mag-answer, we entrust that type of integrity. For sure, as a parent, tutulungan talaga niya. Pero kung he does it for the pupil na ang bata, hindi na talaga, I think they will have a negative impact. But ma'am, kasi in charge ang Regional Quality Assurance, meron po kaming mid-year regional achievement test and it is scheduled on December 10. And we already have prepared our regional achievement test.
Okay. Thank you po, RD Bores. Thank you po once
Ito po
again.
ma'am, mapakita namin, prepared na po ang achievement test. So kung hindi natuto ang bata, lalabas po siya dito na kasi meron talaga silang exam na magawa later on. Pero December pa naman ito. We still have to talk about how it should be done later. Kasi pwede na po siya magpunta sa school in a group of 15. But we will wait for the scenario of COVID case. Salamat po. So meron kaming defense, rather safety nets or mechanism para matuto talaga ang bata. So we have a test for grade 3, grade 10, grade 6, and grade 11 for senior high school, junior high school. We are still conceptualizing for sa grades 1, 2, and kinder. But right now, regional office is preparing na po sa mga test booklets. Salamat po.
Thank you po, RD Bores, for clarification, for emphasizing po itong nasagot na po natin itong katanungan ng ating netizen. So, RD, we thank you for your time and for this opportunity po to inform the public. At ulit nga po, paulit-ulit natin sinasabi po no, na this August 24, magsisimula na po ang ating pasukan. Pero po, ito nga yung mga na-mention po ni RD Bores, yun po yung ating mga learning modalities, mga paraan po nila. I hope na na-clarify po ito. And if you have further questions pa po, you can visit po the school na pinakamalapit po sa inyo para po i-clarify, o yung mga teachers po ng inyong mga anak ay pwede po sa kanila mismo maklarify natin yung mga process, and of course the orientation po para sa pagbubukas ng pasukan. RD Bores, thank you po.
Salamat din for this opportunity of putting across all our mga palisiya, at salamat po sa suporta to help our teachers and parents through your program. And I hope we could have another follow-up just before the opening of classes. Kasi ngayon, if you are talking, we are preparing na for the radio scripts. Pinag-aaralan po namin lahat para matulungan yung magamit ng radio.
Okay, so we also hope for that po, RD, para mas marami pa po tayong ma-share sa ating mga magulang and sa ating mga viewers. Thank you once again po. That was Dr. Isabelita Bores, the Regional Director of Department of Education, Region 9, live po via Google Meet. Thank you, and until next time po, RD, stay safe po sa inyo.
Salamat.
Okay? So once again po, yun po ang ating mga guests ngayong araw, at yun po yung mga naipabahagi po natin sa inyong lahat ngayong araw po. So before we end our program, makibalita po tayo sa live po via phone patch. Kung kumusta na po ang status po sa Zamboanga del Sur naman, sa probinsya po ng Zamboanga del Sur, kung kumusta po doon. Sir June, we have Sir June Corge on the line po.
Yes, magandang umaga, Myra. 100 na swab samples na nakuha galing sa mga suspected patients ng coronavirus disease 2019 na itinadala ng Integrated Provincial Health Office sa Zamboanga City Medical Center ang nagnegatibo sa virus. Ayon kay Dr. Natalio Cagapag Jr., ang hepe ng Zamboanga del Sur Medical Center at Officer in Charge ng Integrated Provincial Health Office, ikinatutuan niya ang pagkatanggap ng tawag galing sa Regional Epidemiology and Surveillance Unit or WISO na nagpaalam sa kanya na 100 swab samples na pinadala sa DSMC kamakailan lang ay negatibo sa virus, at ito ay nangangahulugan na zero COVID-19 ang galing sa mga napadalang swab test samples. Nagpasalamat naman ang hipi ng IPHO na ang lalawigan ay walang local transmission dahil sa mabuting pamumuno at sincere commitment sa government officials na pinanungkulan ng Governor Victor Yu at sa pagtulong ng local health authorities upang mapaglabanan ang naturang sakit. At sa ating COVID-19 update, ayon sa datos na pinalabas ng Integrated Provincial Health Office sa kanilang COVID-19 surveillance report as of August 10, sa kabuuan, 46 na COVID-19 cases ang naitala sa lalawigan. 37 ay nakonfirmang recovered at 9 naman ang active cases. Ang mga pasyente ay asymptomatic, medically stable at naghintay ng final 14-day quarantine. Nakuna na rin sila ng swab test at ipaprocess for confirmatory testing, at ang resulta ay inaasahan na lalabas sa linggo ito. Si Kagampang ang umapila sa publiko na manatiling kalmado, vigilant at manalangin sa Diyos. Pagsunod sa basic health protocols sa pamamagitan ng pagsuot ng face mask, pag-practice ng social distancing, paghugas ng kamay, at hindi paglabas ng bahay kung hindi kinakailangan. Yan po, Myra, ang ating situation report. At para sa Bantay COVID-19 Zampen update, nag-uulat live mula sa Zamboanga del Sur Information Center, ito si John Corge.
Okay, maraming salamat po, Sir June. Stay safe parati po dyan, sir. Mayong buntag sa inyong tanan din sa Zamboanga del Sur. So thank you po once again, live via phone patch, Sir June Corge. Nagbigay po siya ng update patungkol nga po sa nangyayari ngayon or sa status po ng COVID-19 cases rin sa Zamboanga del Sur. So again po, maraming salamat sa ating mga guests from Department of Health and Department of Education. Reminders lang po, Zamboanga City is still under GCQ. Please stay safe, stay at home, wear your face mask, practice social distancing and frequent hand washing. Panawagan po sa mga residente ng Zamboanga City kung sino po ang nakakakilala kay Shainalyn Atari. Humihingi po si Shainalyn Lynn ng medical assistance sa DSWD ngunit hindi niya maibigay or naibigay ang ilang mga importanteng detalye. Si Lynn Atari ay isang PWD, 20 years old, taga Giwan, Zamboanga City. Pakitawag po sa DSWD 9 sa 991-0858 at hanapin po si Emily Natividad ng Protective Services Division. So August is a family planning month. Stay safe and stay healthy at mag-family planning. Special thanks po again sa ating mga media friends and followers sa Zamboanga Peninsula, Basilan, Sulu, and Tawi-Tawi for tuning in. Stay tuned to PIA Western Mindanao Facebook page for more truthful news and information. Thank you again to our partners, the ICT Mindanao Cluster 1, eMedia Mo, Solid, Mindanao Cable Television, RMN DXRZ Zamboanga City, RMN DXPR Pagadian City, RPN DXXX Zamboanga, Radio Pilipinas, DXNO Basilan, DXGD Bonggao, Tawi-Tawi, City Government of Zamboanga PIO Team, Philippine National Police PRO 9, Team Tabak, Victory Zamboanga del Sur, Facebook page, Regional Interagency Task Force on Emerging Infectious Diseases, Department of Health Region 9, Zamboanga Press Club Incorporated, and Mindanao Communicators Network. Maraming salamat pong muli and thank you to our PIA team, technical team for making this Kapihan episode possible. Maraming salamat po and magkita-kita po tayong muli sa mga next Kapihan episode or ating public briefing po sa Friday po. Kita-kita po tayong muli. Again, stay home po, stay alive, and stay safe po sa ating lahat. Ito pong muli si Myra Espinosa para sa Kapihan na Zamboanga. Muchísimas gracias.